32માં જ્ઞાન યજ્ઞને આજના બીજા સત્રમાં સર્વેનું સ્વાગત છે. આજે આપણે સાથે ડૉક્ટર કીર્તિ બેન્દ્રે જે વુમન્સ હેલ્થ આ વિષય પર ડિસ્કશન કરવાના છે. હું સમીર સરને કહીશ એમનું શ્રીફળ અને શોલથી સન્માન કરવા માટે.
Shall I start?
Dr. Kirti Bendre, she is professor and unit head in obstetrics and gynecologist at KJ Somaya Medical College. A Maharashtra University of Health Sciences approved UG and PG teacher છે. She is recipient of Dr. Pramila Ben Bhatia Young Scientist Award. Yes, ma'am. Now you can start. Thank you.
Yeah, thank you so much for that kind introduction. Hello all. Good morning. I'm Dr. Kirti Bendre, and I was given a topic about women's health. So, what I thought was that I was not sure what was the audience, so I have tried to cover both, like adolescent, like for college-going girls and boys, as well as the menopausal women. So a large group I'm going to cover. So let's see. So see, this is a beautiful slide. Can you see the slide, or we can dim the lights? See, this is a beautiful slide of circle of life. Okay, from a caterpillar, it becomes a cocoon, and then it becomes a beautiful butterfly. Okay, the woman's journey is same like this. So first I will be covering about adolescent or pubertal changes. So while growing up, it's not easy. Okay, as I can see, there are few grown-up women also are there, and it's very difficult when you have adolescent children. So there are lots of questions in their minds while growing up. Okay, so what are the changes? There are sudden changes in their body, and what are the especially today I'm going to talk about the women. So what are the normal changes? What are the normal periods? All those questions may arise. So what are the changes in the woman's body? Is that the breast bud starts appearing by the age of 8 to 13 years. Pubic hair, height increases. Menarche, that is onset of periods or onset of menstruation, starts by around 10 to 14 years. Then the adult breast development and the pubic hair. Okay, so see, these are all normal changes we all should know. I'm standing here giving you a very scientific scenario about this. I can see there are many boys over here, but they did not feel, when we don't feel embarrassed, you should not feel embarrassed or ashamed or ye. This is a true knowledge which you all should be getting. So there are number of changes occur at this age. So the first one is the monthly period. So always the girls as well as the parents or mothers, they come to me very frequently asking me, Madam, is it normal? So what are normal periods? Okay, so usually the period starts between 10 to 14 years. It usually lasts between 7 days, 3 to 7 days. Anything less than that or more than that is abnormal. Okay, you'll need 2 to 4 sanitary napkins per day. Minimal cramps may occur. Okay, and there is always a variation. Everybody is not the same. So mothers and girls, they should understand we are not the same. We have different color. Okay, we have different eyes. Okay, similarly, everyone will have different cycle. But when you should see a doctor, okay, which is extremely important. You should see a doctor if your daughter does not get period by the age of 15, or she gets very early period. Nowadays we are seeing girls, okay, small children getting periods by the age of 8 years or so. or they are delayed, they are extremely heavy, you are unable to go to the college or the school because of severe pain, so you must see the doctor immediately. Now, again, growing up, it's extremely difficult. Okay, so they have mood variations, and all girls or all women in the reproductive age group, they suffer from something called as premenstrual syndrome. So, which occurs 8 to 10 days prior to the periods. So there you will have a lot of anxiety, depression. Sometimes in India we don't think about it so much, but in the West, in the Europe or America, a lot of importance is given to this premenstrual syndrome. In fact, I got a patient. See, some rare cases also come to us, as a when we work in an institution. So, one girl from Nasik, she's married, but she came to me with severe premenstrual syndrome. So much so that they were about to get, she was about to get divorced because of this problem. And it was really not in her hands. It was the hormones which were troubling. So we can get sometimes such types of patients. Okay, another thing, they are adolescent girls, boys, they are very conscious about their appearance. So pimples or acne is one of the most common problem which they face at this age, and it is nothing but the oil-filled blockage of the sebaceous gland which occurs on the face. Okay, and if it is severe, everyone is going to get at this age. Yeah, that we must remember. But you have to keep the face clean, apply some ointment. If it is severe, you must see the doctor. We can treat it. PCOD. When I was a resident, I finished my MD from KEM Hospital. In 2002, I finished. Okay, so now it's been more than 20 years. And that time, we never saw so many PCOD cases. PCOD is polycystic ovarian disease. Okay, which nowadays I'm getting a lot of girls, medical college girls, physiotherapy, nursing, okay, and some other girls where, they have this problem, like irregular periods. It is characterized by irregular periods, obesity, acne, mild hair growth, etc. So why are we getting this sudden increase in PCOD, which I had never seen 20 years back? Okay, maybe our lifestyle, junk food, lots of pesticides may be probably responsible. We don't know the reason. Okay, pollution again. So what should we do about it? Okay, maintain your body weight. Okay, no obesity, no junk food, soft drinks, etc. Okay, so go back from what we were doing or what your parents were doing in their childhood. So we should be following that type of lifestyle or diet. Here there is, from the nursery to the college or to the professional life, we are giving so much stress to our children. From nursery, 1 or 2 patients, they tell me, मैडम अभी नहीं. मैंने बोला क्या हुआ? अरे फर्स्ट स्टैंडर्ड का एग्ज़ाम है. मैंने बोला क्या फर्स्ट स्टैंडर्ड का एग्ज़ाम है? Why are you so much tensed? First standard exam, if we and the children are taking so much tension, then look at our girls. What is going to happen to them when they grow up? Okay, obesity. In my childhood, or even I can say their childhood, we never had cakes, so many cakes. Okay, occasionally, once in a year, maybe, or twice in a year, cold drinks, no cold drinks. Okay, but nowadays, what we are giving to our children? Okay, every 15 days, we are ordering from Swiggy, Zomato, okay, fast food. So the food which is made in 2 minutes is not good. We should understand that, and which will lead to all these problems, okay. So what we want our kids to have a balanced diet. It is a pyramid. We should have everything in the diet. Grains, vegetables, fruits, milk products. If you are a non-vegetarian, meat also. Okay, so something we should all include in this. But it does not contain the ready-made juices, the ready-made whatever is real. They claim it is real. okay, which is not real. I always tell the patients, they say, madam, we are drinking juice. हम लोग juice पी रहे हैं. Okay, but I said juice, I don't want to, criticize any company or something, but that's not a real juice actually. It's a false. It's all chemical. So instead of that, you can have 2 fruits per day. Okay, so balanced diet is extremely important for us. Watch out for anemia. I have seen young girls. Recently, I have got one patient who came from Satara. Okay, she was pregnant patient, 9 months pregnancy, 9 महीने का pregnancy. Her hemoglobin, her parents brought her because ससुराल वाले ध्यान नहीं दे रहे थे. उसका hemoglobin was 2 grams %. Okay, she was as white as this sheet. Okay, swollen up. We admitted her in ICU, gave her 5 pints of blood, and it was dangerous for her delivery. I mean, baby had already died in the uterus. Okay, so we get such type of patient. And what was the cause? Nutritional anemia. ऐसा नहीं कि उसको कोई disease था. ये just nutrition. Because of nutritional problem, she had this anemia. I'm getting college going girls. उनका anemia, मतलब hemoglobin is 6 grams %, 7 grams %. Recently, I saw a girl who's our staff का daughter. Hemoglobin 6 grams %. Okay, 10th में है girl. Okay, so nobody knows their hemoglobin. We have never checked. Okay, so anemia is a very common problem in our country. Okay, so in fact, we can arrange for camps, simple hemoglobin testing for all the college going students, which is easily correctable. Okay, thalassemia is one other problem which certain communities may have, so we should find out. Okay, so 1 in every 2 adolescent girls suffers from anemia. That means myself, another lady, or in fact in this age group also, in this crowd also, we can find many, 50% may be anemic. Okay, so have iron-rich foods. Okay, at least dietary modification we can have: jaggery, palak, beetroot, etc. Okay, apple. Another problem which we are again facing is osteoporosis, that is decrease in the calcium in the bones. Okay, see, bones are going to remain with you for lifelong. Okay, just now Samir sir was telling me she's 94 years old, so I said yes, it's great, madam. So and look at her generation. Okay, and what are we doing at our generation, and what are we giving to our next generation? Okay, so I'm sure madam must have never eaten or the fast food or the soft drinks or etc. etc. Okay, or bachpan mein they mustn't have gone to the hotel also. Okay, so we should follow that diet. Okay, so osteoporosis. So increase calcium in your diet: milk, curds, paneer, soya, etc. Okay, 1 in 3 women develop a fracture by the age of 65. And please remember, fracture is once you get a fracture, once an old person gets a fracture, they are bedridden. Okay, and then it's very difficult for them to again become mobilized and other problems. Okay, so what you can do is that exercise as well as the calcium intake from the diet. You can also take some supplementations, but from the doctor, prescription from the doctor. So remain healthy, remain active. Somebody had said, you can run. If you cannot run, you walk. If you cannot walk, you crawl, but keep moving. Okay, so keep moving. So even in the old days, we should keep moving. And if we sit at one place, we are gone. Okay, so daily caloric intake, daily exercise is very important. Okay, so it improves health, strength, endurance, etc., etc., and gives your nowadays girls are very much bothered about their body. Okay, this figure, that figure. Okay, don't go for 0 figure. Okay, it's not the Indian standard. Okay, but you exercise, and which will give you a good body. Okay, but don't overdo it. Okay, we see in the films, okay, they are so thin, I want to wear western dress, this, that, okay. So sometimes some girls, especially in the higher class, we see they are absolutely anorexic and they do too much of exercise. So not too much, 20 minutes walking, 10 minutes running, cycling, and I see you have a beautiful campus. So why not make a use of it? You know, in Mumbai we will never get such a huge, such nice campus. Just a walk in the campus would also be good. Another question, okay, is it normal to have to be attracted towards the girls to the boys or boys to the girls? Yes, it's absolutely normal. It's the hormones which are playing, and yeah, but at the same time, you must understand that this age group is premature or immature. So, of course, there will be hormones which are acting, but you must know how to make the right choice, whom to talk about certain issues. Okay, it may be your parents, it may be your colleague, it may be your teacher. How not to get hurt by other people. And nowadays, in this new in this era, it's extremely important. We are listening or we are reading so many incidences. Okay, so they are not safe. Okay, and we have to make them safe. Okay, and how to avoid pregnancy? See, it's probably nobody wants to talk about it, but as a gynecologist, as a as a in our society, we have to tell them how not to become pregnant also. Okay, because you will not know, but we are getting certain college going girls becoming pregnant, coming to us. Okay, we have to avoid that. Okay, and what is the best thing is education. Okay, it can happen with anyone. Okay, we should not be the moral, police or something, but we have to teach them and we have to prevent it. Okay, we have to also tell them about certain sexually transmitted diseases. We have to educate these children. That is AIDS. So unsafe sexual practices, multiple sexual partners, drugs, needle pricks, tattoos, unsafe tattoos can give you AIDS or HIV. Okay, and prevention and making the right choice is the only way to prevent it. Hepatitis B, vaccine is available. The disease is preventable by vaccine. Hepatitis B matlab kya hai? It's a hepatitis, that means liver ka problem. Okay, it is again viral disease. If you get this, तो फिर हम क्रॉनिक हिपेटाइटिस मतलब जॉन्डिस, लीवर कैंसर, लीवर फेल्यूर, ये सब चीज़ें हो सकती हैं. एंड इट इज़ ईजिली प्रिवेंटेबल बाय जस्ट टेकिंग अ वैक्सीन which is easily available. It is extremely cheap. So we don't know whether we have given to this. We can always have a camp or something where we can vaccinate our children. Okay. So today's women are educated, intelligent, self-sufficient, and career conscious. But what are the issues troubling today's youth is how to make the right choices, how to talk about the sex-related issues, how to avoid pregnancy, how not to get hurt by the diseases, how to express yourself, and most importantly, how to say no. Okay, in this. So everybody has seen that Amitabh Bachchan's movie, that no. So you must say no. And you should raise a voice if somebody is abusing you. Okay. Sexual abuse, again, there are multiple helpline numbers. There are certain help which is available. Okay. Children may not talk to you, but we must make them aware that this is bad, this is good. And of course, nowadays in the school, they are teaching them good touch or bad touch. Okay, that's very good so that they can come up. Alcohol, drug abuse. This generation thinks it's cool to smoke weed, to have alcohol. Okay, YouTubes, WhatsApps, and Facebook, Insta. 18 years boys celebrating their birthday with a beer bottle. which we have seen. We have seen our children's friends, school friends, like that. And parents have no idea what they are doing, okay? And it goes on in the college, yeah, but it's not good. You are not mature, okay? You cannot take that decision. And it leads to multiple problems, liver problems, cancer, stroke, hypertension, etc. Drugs, especially certain drugs are so easily available. So we have to be very careful. What do they do? Okay? Smoking. It's not cool to smoke. Please remember, it's not right. And smoking leads to multiple health problems. It is a killer disease. It leads to cancer, various cancers. We have seen certain, especially the tongue cancer, the mouth cancer, and when you have to excise everything, do a supramajor surgery. So say no to tobacco in any form, even gutka, BD, smoking. It's very bad. Okay, but in the end, you relax. Believe it or not, the adults you know, they have been through the same thing. And although they might have forgotten how difficult or confusing growing up can be. So whatever problems you are facing, maybe the similar problems your parents also must have faced. So talk to them. Parents are your best guide, teacher, and your friends also. Now, after this, I'll just cover a few, this thing for menopause, which is a little important, again, event in the women's life. I'm not covering many things about cancer because tomorrow, day after tomorrow, you have various doctors who are talking about cancer awareness, then metabolic syndrome, nutrition, etc. So it's just a brief overview what it is. So what happens at the menopause? Your periods stop. So what happens is that estrogen and progesterone secreted by the ovary, the hormones go down, and there are menopausal symptoms. So there is a risk, once the hormones go down, there is a risk of fracture and the heart disease, Alzheimer's, etc. Okay. Why is menopause? Nowadays, everybody is talking about menopause. Why it is so important? Because now we are living longer. So duration of menopause is increased. So geriatric population is increasing. Therefore, we are again talking about menopause. But we must understand you are not alone. So what all women will face? Okay, irregular bleeding, vaginal dryness, hot flushes, mood swings, depression, sleep disturbances, weight gain, back pain, joint pains, and short-term memory loss. Sometimes we realize we don't remember, अरे क्या नाम था उसका, क्या नाम था, and then we feel, अरे am I losing my memory? But no, this is really a little menopausal symptom, maybe little menopausal symptom. So menopause can affect the woman's body from top to the bottom. There are various symptoms. Okay. In this age group also, some cancers can also come. Okay, so that's why you can develop hypertension, diabetes, etc., etc. Hot flushes. So hot flushes means suddenly you feel warm, your cheeks become red, and you feel that you are sweating. It's just a 1 or 2 minutes thing, and then again you are settled back again. And it is a very, very troublesome symptom. Okay. So wear loose clothes, wear cotton clothes, avoid alcohol, junk food, cold drinks, plenty of fluids, as well as take good sleep, do meditation and yoga. So see, coming again, even our medicine is also telling us the same thing, that come back to meditation and yoga. Okay, PCOD, endometriosis, menopausal symptoms. There are many things where we don't have answer, okay? But the stress, autoimmune disorders, certain autoimmune disorders. So stress, reduce your stress. That is what we feel. Okay, so these are 7 dwarfs of menopause. We become itchy, bitchy, okay, sweaty, bloaty, sleepy, okay, forgetful, and psycho. Sometimes it's psycho. This is some people say अरे psychotic behavior कर रही है, okay, because at menopause you don't know, you are grown up, okay, you have a family, okay, the children are also growing up, okay, so you have a daughter who is in an adolescent age group and you are in the menopausal age group, okay, so definitely the hormone plays, okay, and uh, sometimes there is just no family support, nobody understands you what is going on and you are labeled as अरे psychotic behavior करती है, so it's not like that, okay, and sometimes I pity the husbands also because they have to face the menopausal wife and pre or perimenopausal wife and a growing up girl, adolescent. So I pity fathers many times, okay, but they have to support both of them, okay, and understand. Psychological symptoms. So have positive attitude, healthy diet, don't skip meals. In that time we always have a घर पे डब्बा बनाने का है, सुबह में टाइम नहीं मिला, ऑफिस जाना है, यहाँ पे आना है, वहाँ पे जाना है, we don't eat, okay, and just have a cup of tea, coffee and come over here. But it should not be like that. Exercise regularly. Many times women say मुझे exercise का क्या ज़रूरत है, मैं तो काम करती हूँ, घर पे इतना मेरा काम है, okay, but it's not 20 minutes dedicated for you, okay, that is what we want, okay, that is called as exercise and not घर का काम, okay. Deep breathing, again I am coming back to the same thing which you may be knowing better than me, okay, pray, meditation, focus on hobbies. See, for 50 years the woman has given her life to the family, है ना, आपने अपना 50 साल फैमिली के लिए दिया, है ना, you have never developed any friends or any hobby because you never got time, okay, so suddenly a hobby will not, you cannot suddenly develop a hobby at the age of 50 years, okay, but try from the beginning, okay, ऐसा नहीं कि एक दिन में मुझे हॉबी बैडमिंटन खेलने को आएगा, टेबल टेनिस खेलने को आएगा, स्विमिंग आएगा, नो, but you make an effort, okay, it's difficult but you can do it, okay. There are certain skin problems which we are worried about, again dryness, wrinkles, so there are treatments available at this age also. If somebody wants to do it, they can visit a skin person. Sexual function, again decrease in the sexual drive, loss of libido, dryness, they are the common problems. Of course the treatment is available. Urge incontinence, okay, suddenly you want to go for susu, urine, okay, and you can't control it, okay, it's very very common at menopause. You must have seen your grandmother's children or your mothers having little incontinence, okay. Children, I'm just going to finish, kids or my dear ye, if you have any doubts you can ask me, okay. So I would like just 5-10 minutes of your attention. Urogenital symptoms. For urogenital symptoms, you should have Kegels exercises which can be easily done, sitting, standing, etc., etc. Easily you can practice. You can also prevent prolapse of the uterus by doing this. Osteoporosis. Again, I told you, osteoporosis is the calcium. Calcium gets depleted by the time you become 65, 70 years of age, okay. So you must have calcium deposition, vitamin D and exercise. Sirf calcium khane se bones will not become strong. With that you have to do certain exercises, then only the bones will be stronger, okay. 1 in 2 Indian women above the age of 45 will suffer from osteoporosis. We can also have the camps, easily the machines are available which are mobile machines where they can measure your body fat, your BMI as well as your calcium, okay, whether you are osteoporotic or not, okay. We can arrange the camps ki starting from adolescent to menopause anyone can utilize, and your calcium levels, whether you are osteoporotic, osteopenia or you have normal calcium, okay. So getting shorter, okay, they do like this hunch. So Getting shorter is the first sign. So always stand straight and tall. Okay, this is first sign of vertebral problems. Okay, fracture can turn your life into density. See, if I start growing up, if I 60, 70, my parents will always say, मुझे हमें एक ही डर है कि हमें गिरना नहीं है और गिरने के बाद हमको फ्रैक्चर नहीं चाहिए. एक बार हम लोग गिर गए, बेड पे रह गए, then we may not be able to get up. Okay, or they may die also. Okay, so fractures, broken wrists can be deadly. Okay, that means your life may be finished. Okay, there are very few people after fracture neck femur they will get up. Okay, so 1 in 4 people who suffer from a hip fracture will die within 1 year. This is a study which is showing. Okay, so it's, you have to prevent it. And how do you prevent it? Just make few changes. Go for a walk, have calcium, have vitamin D. You can exercise or hormone replacement therapy. Those who are proven osteoporotic or very, very high risk for fractures, we can give them HRT. That means hormone replacement therapy. So this is a beautiful slide which I like. Calcium is like money saved in your bank account. So you keep on depositing this money. Okay, from the एज ग्रुप ऑफ 14 ईयर्स, 14 साल से आप कैल्शियम डालो आपके एफडी में, एंड एफडी विल गेट मैच्योर्ड व्हेन यू आर अराउंड 60-70. Okay, that time it will be useful. So calcium deposition does not occur in one day. It starts from the adolescent age. पर हमें देर हुई है क्या? नहीं. Okay, you may say कि okay, I am 50, so now I am too late or what? So no, it's not too late. Okay, at least start now. Okay, start saving your calcium. Okay, milk products, spinach, eggs, oranges, pulses, milk in any form will give you good amount of calcium. Nachni or ragi will give you good amount of calcium. Okay, vitamin D, we are not going into the sunlight. We say no, sunlight, bapre, my skin will become dark. Okay, and plus I am putting lot of sunscreen, okay, to avoid that darkness. Half an hour of, that is the benefit of walking early in the morning. Okay, so early morning walk will give you good sunlight. Okay, butter, eggs, vitamin D also, and nowadays small capsules of vitamin D, they are easily available. Once in a week you have to take for 8 weeks. Okay, nothing very. Some women we can also give estrogen plus progesterone, specifically estrogen for certain symptoms. Okay, which can be which can prevent this problem, but it should be taken not from over the counter. Chemist के पास गए मुझे ये दे दो, chemist देगा भी नहीं. But you have to go to a proper gynecologist, get yourself examined. If required, then only estrogen will be given to you. In 2000, there was a huge, this HRT came into market. मतलब कंपनी वाले मार्केट में नया प्रोडक्ट लाते हैं तभी बहुत सारा एडवर्टाइज करते हैं. इस्ट्रोजेन हार्मोन रिप्लेसमेंट थेरेपी मार्केट में आ गया इन फ्रॉम 1990 to 2000. And it was considered as a wonder drug, anti-aging drug. Okay, many women in America and Europe, they took it. Okay, oral estrogen. After 10 years, the study came out that oral estrogen taken for a very long time will give rise to breast cancer. Okay, and the DVT, that is stroke or deep vein thrombosis. Okay, so nowadays we are, so again when I was a resident, HRT clinics निकले थे हमारे इंडिया में और मुंबई में. ओके, पीपल वेयर क्लेमिंग कि मैं HRT स्पेशलिस्ट हूँ, मतलब हार्मोन रिप्ले मेनोपॉजल स्पेशलिस्ट, ये वो. सो ऑल दोज क्लिनिक्स शट डाउन आफ्टर दिस स्टडी केम. ओके, इट वॉज अ वेरी ह्यूज स्टडी एंड नाउ, so therefore now we are giving estrogen to a very limited population जिनको सच में ज़रूरत है, especially osteoporotic. Okay, so and we will decide the dose, कितना देना है, क्या देना है, and we will monitor those women. Okay, so estrogen is still most effective therapy, but to prevent all these things, but a shorter and a shorter dose is what we want. Again, a common problem is coronary vascular disease or a heart attack. Okay, so these are certain symptoms of heart attack like shoulder pain, back pain also, acidity जैसा feeling, chest heaviness, and it can happen nowadays at 35 years of age also. So we have to be careful. Obesity, age, alcohol, smoking, and genetic or hereditary. Again, they are the risk factors for the heart disease. Breast cancer, it has become so common, so common. Okay, we have a mammography machine at KJ Somaya Hospital. Okay, it's extremely cheap. If you go outside anywhere, mammographies are very costly, and most of the hospitals are not doing it also. We are lucky to have mammography machine installed at our place, and we have kept it at a very cheap rate. So once in 3 years, after the age of 45, everyone should undergo a mammography. One mammography at least, once in 5 years. So lump, discharge, mass, okay. If you have a cancer history in your family, you must do a mammography. Okay, self-breast examination. Anytime you feel a lump, you should be seeing what is the lump, and you should visit a doctor. This is a simple mammography machine which we can do. Okay, cervix. Nowadays cancers, uterine cancer. This is garbhashay ke mukh ka cancer. It's very abnormal bleeding, foul smelling discharge. These are the symptoms. So simple test, get a pap smear. We are organizing pap smear camps. Women are not coming forward because they feel shy. Okay, but in our hospital, if you see, extreme privacy is maintained, very nice atmosphere. We have a renovated OPD now, obstetric gynec OPD. So nice, all sterile instrument, autoclaved ones, everything, this thing precaution is taken, and then it's a very 5 minutes test. Every woman should do it after in fact WHO says after the age of 25 you should do it, but in India we are saying at least after the age of 35 once. If one test is normal, then no need for repeat every year. Once in 3 years or once in 5 years will also do. So hardly 5 times you have to go to a doctor. What is most important? I have been telling this to all the school children or college people who invite me for a talk. I tell them that nowadays cancer, cervical cancer can be prevented by giving vaccine to our children. Okay, girls as well as boys. Okay, बॉयज़ में दूसरे टाइप का कैंसर रहता है, गर्ल्स में 3 टाइप का दूसरा, वल्वल कैंसर, सर्वाइकल कैंसर एक्सेट्रा. Just one vaccine and we can eradicate this. Okay, so come to us for more information and cervical, for vaccine information and getting a vaccine. Pap smear is a very simple test. So in the end, okay, I will say menopause is not a pause, but it's a beginning of new life. Okay, growing old is natural, but feeling old is not. Okay, so what you feel is more important. Young woman or an old lady, children or young audience, you can go on the net and find out whether you can see the old woman also in this or a young girl also. So it depends on you, what you feel it. Okay, whether it's a, and in the end, Swami Vivekananda ji has said, there is a chance for the welfare of the world only when the condition of the women improves. It is not possible for a bird to fly on only one wing. Okay, so with this note, I would end my lecture. Thank you so much for patience. Thank you.
Thank you, ma'am. After your lecture, we all will surely bring changes in our lifestyle, diet and include exercise. आज हमारे लिए ये सौभाग्य का विषय है कि हमारे बीच हमारी माँ सदृश्य श्रीमती लीलाबेन कोटक जी आज हमारे बीच उपस्थित है. यस, थैंक यू मैम. आज शाम को 6 to 7:30 निखिल ताराचंदानी, उनका सुनहरे नगमे ये चीज़ पे कार्यक्रम है. कल सुबह 18 to 25 जनवरी परम पूज्य स्वामिनी तन्मयानंद जी सरस्वती इनका राम गीता यह विषय पर लेक्चर होगा.
Thank you very much.
Okay. And tomorrow from 8:15 to 9:15 a.m. There will be lecture of Dr. Mayur Mewada on metabolic diseases.
Thank you. Thank you so much. And I feel honored to be here. And I was not knowing this. I was just talking with Dr. Ms. Mrunal that what is it. And I really feel proud to be a part of this program. Thank you. Thank you, madam.